I must admit it came as a big surprise, really. I was shocked because I'd got the tiniest lump in my neck. I was surprised I even found it, really, but I did. Then I had this needle test that they did. I went back for my results and they did say it was cancer. But then I went home and when I mentioned it to my mum, she was like beside herself. She was worse than me. And I think perhaps she would be, you know, me being her daughter, but I had a neck dissection and then followed by radiotherapy and chemotherapy. And then unfortunately, after the chemotherapy, my mouth became extremely dry, to the point really where it was so difficult to even eat anything. The hospital suggested all sorts of sprays and tablets to try and help me, but unfortunately nothing worked. And then one day when I went, they mentioned about acupuncture, which I didn't really know, you know, it existed within the NHS.
If you can imagine, my patients come to me and they say, I don't sleep at night, I'm awake, anything from 2, 3, 8 to 10 times every single night. They're reaching for the water. It only gives them, I don't know, 30 seconds, a minute of relief. They try and get back to sleep. They can't taste their favourite food. Imagine if you can't go out to a pub no more with a family. They say, can't go out for social events because there's nothing on the menu that I can eat, or maybe soup. And what they can eat, it doesn't taste the same. And they just say this just affects their whole life. But through having acupuncture, they say some people, as I've already said, it does help them eat some of their favourite foods. It does help with the swallow, it does help with the taste. These people have this 24 hours a day, 7 days a week, and for some people sadly it never changes. So get ahead, if we can make a difference to that dry mouth, it makes a difference to those patients.
It has helped. My mouth is still very dry. It's nothing like really it should be, but it certainly has helped because now my food, I can eat anything. It certainly made a difference with the taste because at one point I couldn't taste anything. I really felt in the end like I just got to get on with this and get through it, which I did. I must admit at one point I felt like I've had enough of this, I can't do it anymore. But no, I did finish all my treatment and I'm glad I did. So yeah, it was a big thing to take in, but I really just got on with it in the end. So I think you've got to really, so otherwise I think you felt you'd just go under. So.